Hi, I'm Dr. Steve Haley. I'm actually one of the chiropractors here at the Center for Health and Wellbeing. Here at the center, we are a holistic center. We're looking to take a very holistic approach to treating the patient. The first line in our mission statement is to bridge the gap between conventional medicine and alternative therapies. So as a chiropractor, definitely I would be considered what you would consider a traditional hands-on based chiropractor. It's very rare that somebody comes to me and we don't do spinal adjustments or what some people might call spinal manipulations. We also use some other therapies though. We do get involved downstairs. I say downstairs because my office is in the basement. It's nice and cool down there. We get involved with active rehab and exercise rehab, actually looking to strengthen and stabilize weak muscles so that we can make sure that the adjustments hold longer. We use traction, we use some myofascial release. We do a lot of different things down and through there. And the unique thing about that is that's a more broad-based approach than many chiropractors take, even that I took for much of my early 23 years in this practice, where I just simply focused on the adjustment. Now I have time here at the center to actually address some of the underlying root causes of why the spine is getting misaligned or other joints within the body, and addressing some of those causes right in through there. And we'll see a wide range of patients here, all the way from children all the way up to geriatrics. Some people might wonder why children get adjusted. They get injured in sporting events, a lot of different reasons why they might be getting adjusted as well. So if there's something that we can help you with, please schedule an appointment, talk to one of the providers here and schedule an appointment to come down and see myself or to see one of the other chiropractors that's here at the center. We hope to see you soon. Thank you very much and have a great day.